Hello, my name is Lisa-Marie Sauvé from the Emotional Health CBT Clinic in Montreal. I am a child, adolescent, and adult clinical psychologist, and I'm here today to share with you some tips or strategies to parent children during this difficult period of confinement for COVID-19. So, first of all, if you're here today and you're listening to this video, I want you to congratulate yourself. If you're a parent, just take a second to realize that you've now been surviving more than a month in confinement, sometimes with multiple children. So I would like you to take a second to give yourself a hug or a well-deserved pat on the back. And especially if you're making extra time to come here and hear about parenting tips. So I will quickly share about 5 strategies or topics about parenting and how to alleviate parental and familial stress during this period. So I will use what's called the KISS principle, and I will try to keep it simple, silly, and not to overcomplicate. So my first tip for you is to establish a flexible schedule or routine for your young children. What I mean by that is that kids of all ages, but particularly young kids whose brain is fine-tuning their circadian rhythm, will find it harder to keep a regular routine during this time. They will definitely find it harder also to get to sleep naturally. So try not to delay their usual sleep time too much, but more importantly, keep a steady bedtime, even a later one. And remember to step down from the excitement of the day and keep the same sequence of steps as usual. For example, a child can go from playing with a puzzle to then going to take a shower or a good bath and brush their teeth, listening to a relaxing video with parents, read a book, and then go to bed. So if possible, repeating these sequence of 5 or 6 steps every night, regardless of when it's occurring. Again, if possible, have it be around the same time, let's say 8 or 8:30. Like I said, it's normal that it be later, but try to keep it up from day to day and even on weekends if possible. Do not feel obliged, though, to wake up your children in the morning if you don't have to. One of the benefits that we've had through this confinement is that a lot of us have been able to skip on the morning routine of having to rush and wake up the kids extra early to then go to bed. So if it's possible, let them sleep in and let them wake up on their own. There is no need for them to be woken up at a specific time. Try to also keep reasonably regular meal times and play times. Children, especially young children, between the ages of 5 and 10, let's say, thrive on routine, especially during these anxious times. Try not, like I said, to set alarms or timers for everything, because the time is now specifically, it is time to be flexible with our children and show them this skill. Remember also that children do not need to be organized for 12 hours a day, and teaching them how to organize their day according to their interests helps build skills like independence and autonomy and their own, develop a set of their own pleasurable activities too. You will be able to allow more screen time of TV and electronics than usual while still maintaining some general pediatric guidelines, meaning that if possible, keeping children under the age of 2 with a minimal set limit of a little bit of time on an iPad or on a computer doing an educational task is perfectly okay. There's no need to restrict it completely. And there's actually, since 2017 and 2018, there have been much relaxed guidelines showing that content and variety, and especially if children are in front of educational programs, it is absolutely not dangerous to allow them to have even what would be considered a lot of screen time, meaning more than 30 minutes or up to a few hours in a complete day. So again, the important thing to remember with screen time is to always set limits, that might be very specific to your household, but avoid punishment and rigidity. Children will be more attracted to screens during this anxious time. It is their way of trying to self-soothe. 2, play with your child a little bit every day. I know it's hard to squeeze in playtime with your children between 2 Zoom meetings and trying to take care of a household, but if you can, please do it. Play is an integral part of development for young children, and it teaches them social skills, emotional regulation skills, imagination, creativity, and it also boosts their language. As little as 15 minutes a day with individual kids in a household will also provide them with the necessary positive attention to help them be better behaved the rest of the day. And playing as a parent with multiple kids at the same time provides some structure to their play, guidance, and discipline that may prolong how long they then play amongst themselves as siblings. If you want to, you can also set some timers for very coveted toys, like for example, video games or computers, to promote sharing. And also rough and tumble play, especially with younger children, which means kind of wrestling, getting down on the ground with them and playing with them in a very physical manner, is also something that's extremely important during these times because it helps with their motor skills, with their controlling their aggression and learning how to be boisterous without being aggressive. And it also provides much needed touch and close contact with their parents, which releases feel-good hormones and reduces cortisol and adrenaline, even in a parent that is involved in the rough and tumble play. So my third tip would be to have reasonable expectation for your children. This is really crucial because there's no research showing right now that young or elementary school children must do a certain amount of chores or learning or engaging in any specific activity every day, except for physical activity. That is now recommended at a level of about 60 minutes a day in total for children between 5 and 17 years of age. That being said, that 60-minute can definitely be playing a, like I said, rough and tumble type of play with siblings and then going outside for 15 minutes, just even going on a walk, a family walk, or just playing around the house and being in any other position than sitting or being lying down on a couch or on a bed. So children are naturally very active. So when we mean physical activity, we mean to not have them sit or lie again anywhere for any prolonged period of time. So normal attention spans for children are about double their age, which means that you have to expect about 6 minutes of non-interrupted attention in a 3-year-old playing a game. 6 minutes, you'll say, is really not long, and it is not. So do not expect young children to sit quietly doing anything for much longer than this. For school-age children, they will be about ready to listen or to stay quietly engage in a very mental activity for about 15 or 20 minutes. So do not expect yourself to act as a homeschool teacher or for them to listen to you or engage in a school activity for much longer than that time, that being 15 to 20 minutes. It is much better to provide support for learning activities instead and make them fun and engaging and light and support whatever they're already interested in. If it's, for example, animals, it's perfectly okay to go look up certain books on a type of animal, have them read that book to you or you read them, then ask questions on the book. It's also okay to research on the internet a type of animal or a type of scientific concept that they're interested in, gravity or anything can become basically an opportunity for learning, and this is what we want to foster instead of very rigid having kids sit down at a desk or a kitchen table for extended periods of time. That is really not realistic and it can actually be harmful to the parent-child relationship. So up to number 4, have variety in your day. Rather than focusing on specific tasks getting done routinely or in a timely manner during the day, focus on mixing things up and switch more often between regular activities to keep kids' curiosity, their need of stimulation, and their novelty satisfied. So this will help keep boredom at bay, because I know it's not something we used to talk about a lot before, but definitely boredom is, along with sadness and anxiety and fear, is one of the most intense and unpleasant human emotions. So we want to try to keep that negative emotion at bay. So cycle through a bit of moving, playing, a bit of outdoor time, a bit of sunshine, a bit of learning, and then repeat this cycle for small periods of time throughout the day. The phenomenal thing about kids is that almost everything they do is new to them. So they learn almost every second of every day without us having to impose learning on them. And as I mentioned before, don't worry about teaching them specific concepts or knowledge in anything, but rather realize that they are learning a lot of unconventional things right now, like collaboration, empathy, biology, virology even hygiene, socializing, respect, to name just a few. They're also learning resilience, and by supporting the variety of things you expose them to, you are also teaching them balance and equilibrium. Finally, number 5, you should want to be as gentle, supporting, and loving to your children as possible. Now is not a time for harsh discipline and rigid rules, but more than ever, positive parenting and fostering the parent-child relationship and the connection in meaningful ways. Please be patient. I know it is very difficult, but we need to model the behaviors we want to see in our children. Being present also means to provide adequate timeouts if necessary, and consequences and limits. Absolutely. I am not saying that children should be allowed to run around free and have negative behaviors like yelling and screaming and pushing and throwing things more than usual. So the common sense rules of parenting definitely still apply in this time, but you will want to apply them in a even more non-judgmental, calm, neutral manner than usual, because no one is at their best right now. You should also not expect your parenting or your children's behavior to be at their best. We are all coping with very difficult things right now. It is very normal to be overwhelmed, and it is okay to fail sometimes. Absolutely. So catch your children being good and encourage what's called tootling instead of tattling. So reinforce your kids and reward them, praise them when they come during the day and they tell you something that their sibling has been doing for them or has provided them with, or how their sibling has been positive towards them. That's called tootling. Tattling is saying, oh, mommy, Mia did this to me, and Michael did that. So we want them to come up and say, hey, my older sister Alicia, she was so nice to me. We just played 50 minutes of a board game. I'm so happy, Mom. So this is something we want to encourage. And as I said, you want to use positive reinforcement and rewards as much as you can, because we know that parental and familial conflict increases the amount of cortisol, the stress hormone, and adrenaline in children and parents. So these hormones in turn inhibit the immune system response. So to keep healthy, we absolutely must keep our familial atmosphere as calm as possible. That being not perfect, but as calm and harmonious as possible. And tips like using gentle discipline, like forced choices. For example, you can ask a child when you're asking them to stop playing for the day and to go wash up and go get ready for bedtime, a type of forced choice would be to ask them if they want to go brush their teeth first or put on their PJs. So it's a hidden way to redirect them towards two options that we find are adequate. Note that one option was not keep playing until you get tired, and then sometimes yelling ensues and then the child has difficulty winding down. Reverse psychology is also a great way to provide non-coercive structure. For example, instead of forcing your child to sit down and color, take a coloring book out yourself and start the activity yourself, saying that you're just doing it because of you. So for example, if I'm taking out a coloring book, I'll just start coloring. And then if my child comes up and says, "Mom, what are you doing?" I'll just say, "Oh, I just felt like coloring." And then if they ask you, "Can I join?" you go, "Absolutely. But even if you play and do something else, I'm just going to do this for a while." So the fact of not forcing the child to join is usually much more attractive to the child because they want to be part of our world. We are their safe place right now. So they will naturally be attracted to that. If we are very rigid and we ask them, "Okay, come sit down. We're doing schoolwork for 20 minutes and I don't want you to get out of your seat," or even coloring or anything else, we are reducing the amount of intrinsic motivation that they will have towards the task. Finally, this is not a parenting tip, but a requirement, I think, to stay safe and sane as a parent. Take a little bit of time, even 10, 15 minutes every day, only for yourself to be in your own bubble. This is extremely important because, as we often say, in any crisis situation, just like when we're on a plane and they're teaching us about oxygen masks, you must always, even as a parent, put an oxygen mask on yourself before putting it on a child or a loved one. These situations are the same. We cannot expect to be taking care of our family, partners, even older parents, and not take care of ourselves first. So thank you for joining me today. I hope you found this video instructive. If you want some more information, we will be having a parent Zoom conference of the Stay Safe and Sane series on Tuesday, April 28th from 7 to 8:15. On our website, you will find all of the proper information for joining us. That's at www.cbtclinic.ca. And it is free for anyone who wants to join. So if you want to join me there on the 28th, I will be more than happy going over what I spoke about today and also answering anyone's questions about some of the challenges and just some of the, mysteries of what's going on and how to keep our heads above water right now as parents. Thank you so much. I've been very happy sharing this with you, and have a great day. Bye-bye.